But for this episode, I'm pleased to welcome Lillian Lee. Welcome to the podcast.
Hello. I believe that it's important to help kids because if we do not help them early, my fear is when they become adults, they will not continue to trust the system and they would avoid seeing doctors. Many patients there right now who need our help, they don't go see doctors because, health insurance is very high. Many patients just don't feel comfortable seeing doctors and they wait till last minute. For medicine to succeed, we need to incorporate other aspects like the visual arts, because let's say you have a patient who is nonverbal, like they're autistic. They cannot verbally tell you, oh, where it hurts. A good practice is if you have a diagram of a human body for them and tell them to draw it or show where it hurts with you. Because if I never did my job, if I chose to, I'll help people when I get that MD, if I did that, then those lives that I have saved so far.
Hey, my name is Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have a really special guest. I have yet another interview, and I'm definitely excited to start off this conversation. I think you guys are going to learn a lot from it. So first of all, because I want to make sure I always say this, if you're listening on Spotify, Apple Podcasts, anything like that, make sure you give it a follow. Make sure you share it with someone who you think might enjoy listening to the podcast. And if you're watching on YouTube, make sure you subscribe, hit notifications, do all that stuff, and definitely make sure you share it with some other people. So with all that being said, let's get started with this episode. So for this episode, the guest is a second-year medical student at the CUNY School of Medicine with a unique blend of both the visual arts and sciences. She was a dedicated visual arts major for over 7 years, attending specialized middle and high schools focused solely on the arts. She works as a 911 emergency medical technician in New York, serving both Central and South Brooklyn. In the future, she hopes to become a pediatric surgeon using her trauma skills to help children in emergent situations. And also outside of work and medical school, you can often find her in the gym or outside petting a dog. But for this episode, I'm pleased to welcome Lillian Lee. Welcome to the podcast.
Hello. It's good to be here.
Yeah, I'm glad to have you on the podcast finally. So, really quick, I know I gave a short little bio. Would you mind just giving the people listening to the podcast an introduction to who you are?
So hi everyone, my name is Lillian. Like what James said, during the day I'm a medical student, but at night I serve as a 911 EMT, and I typically do night shifts multiple times a week, and I like to do it because I like to be hands-on and help people in my community.
The first thing you mentioned, which I find pretty interesting, because I don't know if I've had anyone on the podcast with that type of background in terms of medicine, but number one, you're doing the medical student thing during the day. On top of that, working on emergent cases and all those things at night. And so obviously there's a strong passion for all types of healthcare within that. So I'm curious as to what got you interested in medicine and wanting to care for people in that way to begin with.
So what I got into medicine is sort of different from what made me interested in becoming a EMS worker. So first with medicine, I was always curious with how to fix things with my hands. As a kid, I really liked drawing, I liked painting, but my real passion for medicine started when I had a relative who was getting an operation done. She was only 8 years old, and she had to get an emergency spleen removal, so a splenectomy. And I remember from that time, it was a very traumatic experience from her. And she would tell me how the surgeons there, they were very cold. They forced her into the room. She was crying. They were not gentle with her. And because of that traumatic experience, she now has a distrust for physicians, and especially with surgeons. And from me, coming from a visual arts background, I always wondered, what could I do that could make my surgery care better for these kids? Because if I'm going to spend multiple years studying medicine, I want to study it for children so I can help children, because I believe that between all types of patients, children are the only ones who did not ask for their condition or who did not create their condition, like hypertension, diabetes. So I believe they deserve a second chance. So in the future, I hope to be a pediatric surgeon who could help these kids during emergency situations, like an emergency spleen removal. But during these operations, I hope to use my visual arts background, like painting, drawing, whatever, and incorporate my visual arts into my operations. So whether that means me coming into work in the Superman outfit or putting, nice artwork around the room and playing nice Disney music in the operating room, my goal is to make kids feel comfortable during their operation, because not only would it improve their success rates when kids are feeling calm and comfortable, but God forbid the kids do not make it, I hope that the kids would feel happy knowing that they were surrounded by things that they loved. So that is why I want to go into pediatric surgery specifically. And I don't know if you want me to go into the EMS thing.
We could definitely get into that, but
Okay.
I do want to stop you there for a second, because I feel like that was a lot. That was, to me, that's probably one of, I think, the most incredible stories I've heard, on the podcast, in terms of people's motivations and drive with medicine. I think number one, it's an incredible thing that, first of all, highlighting the aspect of distrust, even in a lot of physicians. I think that's something that we see for a lot of people for a number of reasons across the country. And I think number one, for someone to be willing to really try to take that challenge head on, I think is definitely a key thing for the future of healthcare. And then I think also hearing how that experience kind of drove you to really want to care for children, especially, I think that's also another interesting aspect as well. That kind of reminds me of one of the people I interviewed more recently on the podcast as well. And it's definitely an inspiring thing to me, because it shows that there's a real drive there and a real mission and a real purpose behind what you're doing and how you're going about doing that. I think the other thing I want to ask you is, how do you feel like that passion, that drive has pushed you forward when it comes to getting through medical school and getting along that path through medicine? What does that look like for you?
Well, to elaborate on what you said about my passion and stuff, I believe that it's important to help kids, because if we do not help them early, my fear is when they become adults, they will not continue to trust the system, and they would avoid seeing doctors. They would avoid getting surgeries that they need. But anyway, going back to my drive with medical school is very hard. There are many times where I always doubt myself and wonder, am I really cut out for this? Should I just go back into the visual arts? Is there anything else I could do better? But then I remember that if I don't do it, right, who will? Because out of all the medical students and out of all the surgeons and physicians in the world, how many of them actually have a visual arts background? Because back then, Hippocrates, the father of medicine, he said, where art is loved, I forgot the quote, but something along the lines is, where art is love, humanity is saved. I'm not sure, but you guys could search up the Hippocrates quote. But I really do believe that for medicine to succeed, we need to incorporate other aspects, like the visual arts, because the visual arts has helped me not only with being more creative with things, but also doing well with the human anatomy. Because in art school, every morning at 7:30, we would study and draw the human anatomy all the way until 10 a.m. So 3 hours of anatomy work, drawing and sketching, and doing that type of hands-on art allows me to memorize things that people would not typically memorize in medical school. That's why if I were to operate, I could already visualize everything inside without having to open it. So that's why I think it's good for me to keep going, because who else will?
Yeah, that's good. And I think even the point you mentioned there about the visual arts, I never would have even really thought of that, of how that helps you with sort of the visualization of going through stuff like anatomy and kind of understanding, being able to, I guess, even translate that to something like surgery. And so that's, I think, an incredible aspect to me. And I do want to ask you kind of on that point, I know you mentioned even using art to kind of help pediatric patients in the future and stuff like that. Do you feel like there's any ways that we can incorporate in, especially like in medical education, but also like in healthcare in general, so those more like visual or like there's just different aspects that could be a benefit?
Well, I think it's good to practice visual arts in terms of explaining diseases, for example, because medical students were good at explaining things verbally and we use very complex terms. But when it comes to our patients who may be everyday folk and they may not be that educated in terms of STEM, if we're able to draw it out for them, it could definitely help. For example, if I'm trying to operate on a baby and the mommy or daddy does not understand how exactly I'm going to operate, I will just draw it out. So let's say an inguinal hernia for a little boy. They don't exactly know what exactly is a inguinal ring, right? So I will visually draw it out and show them the small intestine protruding from that ring. So then the parents will understand, okay, so basically my surgeon is closing that ring so my baby boy's intestines does not go down. Very simple. But that's why it's good for us medical students to practice drawing out diseases and even our future operations or physical exam steps, because then it allows everyone else to understand.
I'm kind of visualizing that in my head right now, of like what that would look like to be able to really draw things out to try to help patient understand things better. I think that I could imagine that would definitely help in terms of like physician and patient communication and understanding and being on the same page and being able to connect. And so almost kind of makes me think like I might need to get my art skills up a little bit.
Yeah. And even like not just parents, but also children. Like let's say you have a patient who is nonverbal, like they're autistic. They cannot verbally tell you, oh, where hurts, because they just cannot do so. But a good practice is if you have a diagram of a human body for them and tell them to draw it or show where it hurts with using a red marker or whatnot. Because I've done that in the past, and it actually helps the kids with verbal communication disabilities to express themselves. Because I remember when I was a child, I was very shy, and I did not really know how to express myself besides using the visual arts. So it would be good for kids as well.
Yeah, and I think that's an interesting point as well, too. I know we talk quite a lot about your interest in pediatrics. We talk quite a bit about your interest in surgery and some of the ways you feel like that can help better sort of the healthcare system as a whole. I know you also did bring up quite a lot in terms of like EMS and what that's look like. So I'm curious, because I don't think I've had anyone on the podcast with that particular background or who's talked about that extensively. What has that sort of experience looked like, and how is that maybe connected to what you're doing on the more like med school side of things and academic side?
Okay, so first I'll state how I even got into EMS, because I'm going to be very honest with you guys. I did not expect to be doing this job at all. Never planned it, but this event inspired me to do so. So basically, long story short, around 2020, it was my best friend's birthday. And we were at a park in Chinatown. And while we were about to sing happy birthday and blow the candles, behind me, I heard a really loud banging noise. Not gunshot sounds, but very large banging. And then out of nowhere, I heard a woman screaming and asking for help. So with caution, I turned around and I realized that a guy was carrying a large wooden block. Like, the construction wooden blocks, like the really large ones. And essentially, he was using that block and slamming that block on someone's head. And I later found out that the guy's head was the woman's husband. That's why she was screaming for help, because the guy was basically killing her husband in front of her. And I remember during that time, I was thinking two things. Am I safe, right? Are my friends safe? And could I help him? Because realistically, I could not help him. I did not know how to at the time, right? I was just out of high school and I did not know what to do. All I knew was the woman was screaming, all the elderly were running away, kids were screaming, and the guy was bleeding on the ground. And obviously, EMS was not called on time. So the paramedics and the EMTs, they came in late. And by the time they got there, and by the time police got there, the guy who committed the crime escaped. So he ran away. And then I remember from that night, while I was laying down in bed, in, my quiet room, although it was quiet in my room, it was very loud in my head because I kept on hearing the banging, banging, banging noise. So then 2 days later, I decided, I want to help people. And although I'm going to go into med school, I believe if I really want to help people in the future, I need to also help them now. So then I decided to sign up and become a EMT. And from that moment on, I became a 911 EMT. So now I respond to these calls. I respond to 911 emergency calls. Okay. And that's basically my job now.
Wow. So, yeah, sorry. Continue.
No. Yeah, that's basically the job. And it could be tolling sometimes because, like, emotionally, it's hard, because I deal with patients who go through very traumatic things. And after work, although, I said before it's quiet, right? I still hear my patients. I still hear the screams, the visual aspect of the bleeding and what happened. And it's hard because the next morning, like today, I have to be back in school. And I cannot really tell everyone what exactly I'm going through or what is going through in my mind, because I don't think many people could understand unless they're actually there. So it's hard to balance school and work because it's like living two different lives, right? The life of school and then the life of being out there helping people is very different. Yeah.
I think that's definitely, number one, definitely kudos to you for, sharing that story, being willing to share that. I think that's definitely like an interesting motivation that's there. Because number one, I think it shows like your dedication to medicine, for sure. The fact that you're not just looking at how you can help patients in the future, but even now. And then also continuing to kind of show up and try to make whatever impact you can in those types of emergent situations where I'm sure there's plenty of patients and family that are in like some of the worst moments of their lives, at that time.
Yeah, for sure.
Yeah.
Like, also in med school helps too, in where the viruses and the conditions and like the cardiac conditions I learned in med school definitely allows me to be better as a 911 EMT, because the training that I get compared to everyone else in my job is very different. For instance, I had a child who, when we came in, her mouth was enlarged and she was drooling everywhere. She had a really bad fever. And because I have knowledge in viruses, I found out that this little girl had parvovirus. Wow, and she did not get vaccinated at all. And this is a very contagious virus. And she said the rest of her classmates has it as well. So right away, I became very cautious. And my partner and I told him, hey, like, put on a mask and let's be very careful. Because I found out that the mom is also anti-vaccine. But basically, because of med school education, it allowed me to be more knowledgeable with the conditions I treat and the conditions I handle. And then also, like yesterday, I had a patient with an aortic root dissection. Wow. So that was crazy. But because of med school, I learned how to, how to handle it and what to tell the doctors. Because usually other EMTs or paramedics, they would just take the patient in and they wouldn't really know what's going on. Yeah. But by the time I already got to the ER, I said, hey, this patient's having an aortic root dissection. Let's get this done quick. Wow. So that's why med school definitely helps. And I think more medical students should go into EMS because there are many patients there right now who need our help. And they don't go see doctors because, health insurance is very high and many patients just don't feel comfortable seeing doctors and they wait till last minute to call 911. But when they get to meet, healthcare workers like us, like medical students or just people who actually care for them, it changes their perspective on asking for help. And I encourage my patients all the time and sit with them and say, hey, like, let's schedule an appointment with you for your primary care doctor. Let's make sure you take your medications. Let me put your medication near the door so every time you leave the house, you'll remember to take your meds. Little details like that, although I'm only interacting with them for like an hour and a half, little things like that definitely change their lives. Because although, I see multiple patients, not many patients see multiple EMTs. So they will remember what I tell them. And my goal is to make sure my patients do not make the same mistakes that they have done in the past.
Yeah, I think that's definitely a really interesting point, because one thing I think about quite a lot is, I think even as you mentioned like earlier in the podcast, like there's definitely a lot of physician distrust that exists, and for a variety of reasons. And one thing I never really would have thought of is the impact that I think people in shoes like mine could have, or shoes like yours could have, where just by being people who are able to show up and maybe be a little bit more relatable and show that like they really care, I think that's how we kind of help restore some of that trust in the healthcare system, and how we're able to really provide care that's not only, trying to treat a particular disease, but is really trying to help that person and show that like you're there, to kind of help them whatever way possible, the situations they're in.
Yeah, for sure. And especially with CUNY School of Medicine, we learn how to interact with racial minorities. And I think my training here allows me to connect closer with my patients, actually sit with them, have good bedside manner, hold their hands, and not tell them what to do necessarily, but feel their sadness, feel the stress that they're going through. Because I remember I had a patient, he was unconscious and he was having a heart attack. And my partner drove him to the hospital, but I had to drive the wife to the hospital. So I was driving the ambulance. It was around 4:45 in the morning. And I vividly remember her sitting next to me and her crying nonstop. And obviously I could say, oh, like, don't cry right now, it's going to be all okay. No, like, it's okay for families to feel sadness and stress. Yeah. So I remember while I was driving her, I was just telling her, let's get there, let's get to your husband, and let's really make sure he's okay, and I try to distract her a bit with telling her about how each button works in the truck, and try to lighten up her mood and talk about something different, because I don't want her to continue to stress herself and think about the worst case scenario. And she did feel happier, but sadly at the end, her husband did not make it. But I do hope that her ride to the hospital with me was an okay experience for her, because of what I learned in CUNY Med, I learned to try to help our patients feel better. So yeah, that's a little small story.
Yeah, I think that story definitely tells a lot. I definitely appreciate you. I'm definitely grateful for you sharing a lot of these stories, because I think it's helping me kind of process some of the things that I think are important for medicine moving forward, and probably stuff I want to talk about on the podcast a little bit more myself. But I just think I think there definitely needs to be a strong focus on like being willing to just be with patients as people. Like, I feel like I kind of stress that a lot on the podcast, but that's definitely something that I want to make sure that I keep a mindset of.
Yeah, for sure. Like, little things matter a lot with patients. For example, whenever I'm taking a patient, like let's say I'm giving my patient a wristband for the hospital. Yeah. They're going through such a traumatic time, and they're sad and they're stressed, but little things could help them feel a little bit less stressed. For example, like let's say I give you a wristband. I say, oh, Mr. Jones, sorry, I don't really have a nicer watch, but this is going to be your new Rolex watch for your stay here, because it's a little wristband. Or I would bring Mrs. Smith to her bed in the the hospital room, and I would say, oh, Mrs. Smith, like, welcome to our deluxe suite here in Brookdale Hospital. Like things like that. Although it sounds a little silly, it makes them happier and it lightens their mood. So little details do matter. And I hope more physicians and more medical students realize that. And also, I would highly suggest medical students to learn how to do CPR and how to administer Narcan and how to help a patient who fainted, because nothing's more embarrassing than being a medical student and seeing an emergency like that and not knowing what to do. Because everyone will go around and say, where's a doctor, right? Or does anyone know like medicine? And obviously we know medicine, but a lot of us do not know how to do those skills, and we would just be standing back. So I'd highly recommend all of us to learn these skills so we could help our patients now and not later.
Yeah, I think it's definitely a key point that I'm going to think about more for sure, of like, how can we really be able to focus on not just kind of waiting till we get that MD and we become the doctor, or even for myself as like a preclinical med student, waiting until, I'm able to be in that healthcare setting as a part of the team, but even just looking for ways where earlier on we can kind of try to make that impact,
Sure.
And yeah, I think ultimately there's a benefit to be had from that in the long run for the medical system, like you had already mentioned. Well, yeah. So we talked quite a bit about, the medical aspect. We talked quite a bit about, the EMS aspect of things. So where do you see yourself in terms of making the impact of medicine moving forward? So obviously there's trying to finish medical school. There's all of that. But what exactly do you feel like are the next steps, almost like the 5-year plan of sorts, especially like specialty-wise and things like that?
Well, I definitely want to go into pediatric surgery. So I hopefully will be doing my fellowships and my rotations for surgery and help kids through that aspect. But I think I also want to continue doing EMS. And even though I'll be an MD at the time, like in the future, I think I want to continue doing my 911 job, because I want to go into peds, but I also want to help people on the streets. And I also want to help people who are poor, people who don't have resources, people who do not know what to do. Like, I truly believe that my role in life is to help people who actually need help. Like, I want to serve the poor. And I don't want to just be in the operating room alone and work on just surgery patients. I want to expand outwards. Maybe in the future I'll create a clinic or something in those communities. But who knows? All I know is hopefully I could continue doing my 911 job, and whether that means taking up more night shifts or even working morning shifts in the future, I'll be down to do it, because I cannot forget about my patients that I've helped, and I want to continue helping them forward. So yeah.
So definitely appreciate you bringing all of that up for sure. So the last thing I want to ask you before I wrap up the podcast is, for all of the aspiring physicians or perhaps aspiring medical students or people who are considering possibly going into medicine, is there any piece of advice that you would want to leave to those people?
Ooh. If you are here for this profession to help people and to really serve patients, then you should do it now. Because to wait until you get that MD, it'll be too late. Because there are many patients who are dying every day. There are many people suffering from diseases that they do not know they have. But your ability to go out there and really be in the community, that makes a big difference. Because if I never did my job, if I chose to, I'll help people when I get that MD. If I did that, then those lives that I have saved so far would not have been saved. And if you are here to do medicine for the money, trust me, that will not last very long, because the amount of sacrifices, the stress, the physical toll, and the emotional toll, that is not enough. So definitely recommend, if you're going to help people, do it now. And also make sure to, talk to people if you're struggling mentally with work or school, because getting time to talk to people like James and talking to friends and stuff, that makes a big difference. So definitely reach out and take care of yourself too. So yeah.
Yep. So again, appreciate you coming on the podcast and taking the time to just talk about all those different things. I definitely feel like a lot of people learned a lot from this podcast. And if you have, feel free to leave it on the comments. And that really wraps up this episode for today. So appreciate everyone who's listened up to the entirety of this podcast episode. And so with that being said, I'll see you in the next one.